have the meeting going. I'm just getting the
Yep, I see it. It's recording now. Awesome. So I will do a roll call. So I am here. Chair Hughes is here. Vice Chair Doe.
Present. I'm here.
Secretary Jamale.
Here.
Dr. Treasurer Lawson.
Here.
Council Member Crawford.
Here.
Council Member Nandi.
Here.
Council Member Mullins.
Here.
And we know Representative Noor, I don't believe, is joining us. Justin or staff, have you guys heard from Representative Noor?
I've talked to him a little bit, but I did not get in touch with him today. So I would assume the legislative members are just, well, I mean, Jeff stepped down, but I would assume Representative Noor is not joining the duration of session.
Okay, perfect. So I need to, well, there's an edit that I want to add to the agenda. So before we adopt the meeting agenda, can we add, after we adopt the agenda, can we do introductions, since we have new staff members and a new staff member, and she may not, have been able to meet everybody. I know she was able to meet the executive team because we had a meeting last Tuesday, but I want to add that. So before we adopt the meeting agenda, I want to add a quick round of introductions. So if I could add that after we adopt the meeting agenda, then we can go forward. So I want to make that edit to the agenda. So from that, if I can have someone accept the edit, or call for a motion for that.
So moved.
And because we're recording, and I don't know if Shakira can see, when you guys move in second, can you just move with your last name and second with your last name? Just so it'll be easier for her to.
So moved by Crawford.
Thank you. Is there a second?
Second, Mullins.
Any discussion? All in favor?
Aye.
Aye.
Any opposed? Any abstentions? Awesome. Motion carries. Thank you. So can we move to adopt the meeting agenda with that edit? So we moved one to add it, and now we're moving to adopt the agenda.
Okay, look at the agenda first.
Say it one more time.
I know she just sent it. I didn't have the chance to. I'm just saying that if we could just have a minute.
Oh, to look at the agenda?
Yeah, if you don't mind.
There you go.
There you go. Ask and ye shall receive.
Go to my screen, but that's. Thank you. Okay. Oh, okay. You didn't do the correction. Okay, that's fine. No problem. Oh, I'm sorry. I was talking about the minutes, not the agenda.
Okay.
But that should be in your packet.
Yeah, I know that.
Yeah, but we haven't even gotten to the consent agenda. We're just moving to adopt the actual agenda itself. So we've done the edit, and now we just need to adopt the agenda holistically.
Okay.
So is there a motion to adopt the agenda?
Okay, Lawson.
Oh, two people spoke at the same time.
I can't hear the other person though.
Right away.
So who moved?
Somali.
Well, Lawson moved.
Mustafa, was that you?
No, that was not me.
Oh, okay.
Lawson moved. So are you asking for a second, or you want somebody else to move?
A second. I didn't hear who did the original motion though.
I thought I did.
So Lawson moved, and who second?
I can
second.
Oh,
Carol.
go ahead, Wayne.
I second the motion.
Okay, all in favor?
Aye.
Aye.
Any opposed? Any abstentions? All right, motion carries. So I want to go into, if we can just do a quick round of introductions. I'll start, and I'm just going to go by who I see on my screen. and just straight down the list. So Narita Hughes, board chair.
Who are we introducing ourselves to?
Introducing yourself to Amber Jones. She's our new staff member.
Okay.
So
It don't show me everybody anymore, so I was trying to flip through
no,
this.
that's okay. And then I'll kind of call out everybody since I'm going by who's on my screen. So the next person on my screen is Dr. Lawson.
Oh, okay, yeah. Fatima Lawson, treasurer. Is that all?
Yep.
Okay.
Wayne.
Wayne Doe, vice chair.
Tawana.
Tawana Mullins, council member.
Jude.
Jude Nadi, council member.
Mustafa.
Mustafa Jamale, secretary.
Carl.
Carl Crawford, member.
And can we move to staff? So Justin.
Hi, everyone. Justin Terrell, Executive Director of the Council.
Shakira.
Shakira Bradshaw, council, Shakira Bradshaw, office manager.
Amber.
Hi, Amber Jones. I'm the new outreach coordinator for the council. Nice to meet everybody.
Nice to meet you.
Nice to meet you.
Natasha.
Hi, policy intern for the council.
And Jasmine's out sick today. So
Okay. And then if we have any community members, it would be good just to know who's on. I see Denise.
Hello, everyone. Denise Butler. I'm with Career Education and Resource, Inc. Manager. I lead our economic development and business work.
And is it, and help me if I'm well, I will say, if I mispronounce your name, I apologize. Is it Germa?
Yeah, close enough. Gurma.
Okay.
yeah, good to see you.
Gurma, I said.
Okay. And
Yeah,
then
I'm
is
from.
it, oh, go ahead.
I'm from Oromo community of Minnesota, and maybe I don't know, prospective member of your council.
Okay, thank you. And then I have, is it Umbriel?
Yes, Amaryl Okonkwo. I'm just a community member.
Yep, we're I'm just seeing who, so everybody knows who's on.
Okay.
On the phone since we're not face to face.
Okay.
I see Nasibu, but Nasibu is trying to join. So I'm gonna go to, and I know I'm gonna mess his name up. Achukwa?
Hi, that's okay. Chuku.
Achukwu.
Naje. Okay, Chuku Naje.
Okay, thank you.
I'm a community member from Umune Cultural Association.
Awesome. Then I see the last person is Nasibu. Can you hear us, Nasibu? I don't know if he's connected.
See two other people.
I do. I see Georgette, and then I also see a 651 number.
Mm-hmm.
Well, I'm gonna move on because I don't want to belabor this. So if I can have a motion to approve and accept the consent agenda. So the items on the consent agenda are the approval of the minutes, which I didn't note any corrections. The staff memo that is minus the any action items. Shakira, can you mute everybody for right now? Because I'm getting feedback from someone. And then the last item on the consent agenda is the 40th anniversary. And if people want more context about the 40th, then that item can be pulled. Are there any items that you want pulled before we move to accept the consent agenda?
The 40th anniversary.
Okay.
Second, Jim Allen.
All in favor?
Aye.
Aye.
Are there any opposed? Any abstentions? All right, motion carries. So let's go ahead and move to the 40th anniversary. Tawana, was there anything specific that you wanted covered from that?
I'm trying to figure out how to get back to it. I did have some notes on there, but I don't know how to get back out of here.
Here's what I can share with you. When the exec team members met, one of the things that we talked about with the 40th anniversary is originally we had talked about doing something this summer. Because of the pandemic that we're currently under, what we have decided is we said we should move it till later in the year, until everything is, or in the fall, till everything is clear.
Mm-hmm.
Did you find your notes?
And get back. No, I think it's only giving me the option to leave meeting. So
okay.
I don't want to go back out.
Okay.
But that's fine. If it's pushed out, we'll bring it up later.
Okay. Yeah, and that's what we wanted to. We just said it makes sense because originally, we said we should do something prior to the end of the fiscal year, but not knowing where we're going to be, and also knowing that right now we're looking at a May 4th for the stay-at-home order, and I'm going to use this term potentially being lifted. It just makes sense because we really have not been able to physically meet and really have a full-fledged agenda planned out for what we want this to look like, and being able to kind of move forward and acknowledge the 40 years from the council like it really should be acknowledged.
I know my questions was around the whole dinner idea, but it's fine. We'll talk about it next time. Yeah.
Okay. Yeah, because I don't think that's been quite flushed.
Okay.
Okay. Anybody else have any other questions in reference to the 40th? And feel free, you guys, to use the chat and just address your questions to me too, just because I know there's about 20 of us on the call. So if
well, I just want to add.
Oh, go ahead.
Just want to add what you said, just for Council Member Mullins, that everything is not flushed out yet. The same items that we had discussed before, so they're still on the table. So because we're pushing it up a little bit, we'll be having more discussions, including what the budget is going to look like. So we haven't finished that yet.
Okay.
Any other conversation about this? Okay, so I'm going to turn it over to Dr. Lawson for the financial report.
Out and then go to my desktop because I have it on my desktop. The financial report.
And we have it on the screen, which secure.
No, she doesn't.
Okay.
Just the manager's report so that they can see what we have, and then we. Okay, would you scroll up a little? Oh, oops. It's so hard if you're not. Maybe I should.
You may have to minimize it. Yeah.
Yeah.
There you go.
Okay, here we are. So this is the. Okay, this is the report that we have, ladies and gentlemen. As you can see, the most important column that I've always reported is how much we have left to spend. So as of now, or today, we have $19,007.24 cents. Thank you very much for highlighting it to spend. And then the last time we had some negatives. So I'm glad that they have cleaned all that out and everything has been encumbered and taken care of. So we are at $19,007.24. If you have any questions, feel free to ask, please.
So,
Are there
this
any
is,
questions?
yeah, I just got a quick question. What are we looking at, like two months to go for the year or so, the fiscal year? Are we expecting to have some sort of a surplus, so to speak, left over, particularly from other operating costs that we have? Seems that hasn't, well, that's down to like 2,000, I think.
Yeah, we only have 2,167 left in that particular line item.
Right.
And we have about what, 2 months? No, 3. Well, we have April, May, June.
2.
About 3, right? June 30th.
Right.
So
Yeah,
I do not see any surplus in our future, but I do not think that will go over either.
Okay.
So the goal is for us to stay within budget.
Right.
Yeah.
And keeping in mind too that you know, this does not roll back to the general fund because you can roll it over because the biennium is 1 more year.
Right.
Mm-hmm.
Right.
Yeah.
That's good.
Yeah, it's a bonding year.
Yeah. Any other questions in reference to the financial report? So hearing none, do we have the commissioner on? Do we know? Justin or Shakira?
I will shoot her a text message.
Okay.
All right.
Well, thank you.
Thanks, Dr. Lawson.
You're welcome.
So I think while we're waiting on the commissioner, and if she happens to jump on, then we will kind of stop. I will keep going. I'll move into, I'll keep going down the agenda and move into public comments.
So, Madam Chair, how did that happen? Did they send you the questions ahead of time, or are they just
So
signing?
that's where I'm going to ask Shakira.
Okay.
Shakira, did you get questions ahead of time?
I have not gotten any questions.
I do know one person that reached out to me directly is Denise Butler. So I am going to go ahead and have Denise speak. And Denise, if we can have you take about 1 to 2 minutes max to kind of share what you want to present to the council.
So like the document I want to present, just share about that and then just not go in deep about it. Is that what you're saying? Or
Yeah, because we typically ask for about 1 to 2 minutes from the community members, because we just never know who all wants to have something to say.
Agree, that works for me. So our economic development work is about changing the way in which the narrative is around micro businesses, micro businesses of color, helping to engage government and different systems around that framing and understanding, and having the micro businesses be able to create that narrative. So providing visibility, changing the language and narrative to make sure that resources can be changed to fit what these businesses need. Is not always having these businesses being told, you need to do this, that, and the other to be eligible for things, but changing the eligibility and qualifications. So that's a lot of our economic development advocacy work has been about. And all that has been to deal with where we're at now. Because here it is, COVID happens, there's resources that are being put out there, but unfortunately our businesses have not been built to be able to take advantage of a lot of the resources that are being put out there. And so right now we have a petition that is strictly asking for separate funds that will be available as far as micro grants, not loans. We already know that a lot of our businesses have not been able to fit in that conventional lender, being able to go to conventional lender categories, and a lot of them have relied on nonprofit lenders, and even some of them have not been able to receive funding for their businesses from the nonprofit lenders. So it's saying, let's be intentional in advocating and making sure that these business owners have the funds to be able to survive through COVID-19.
And are there any questions for Denise on what she presented from the council?
I have a question.
Oh, okay.
Well, I can yield to you, Madam Treasurer. You can go first.
Are you sure? Okay, Ms. Denise, do you know any of the organizations that are getting the money? I know for a fact that one ethnic organization applied for some funds. They thought that they qualified for it because they fit the criteria. And then they got a response that, oh, they have to go through another organization. And they didn't mention which one, although they had a link. They directed them to that organization, and that organization has a lot of red tapes that would not make people qualify. So I don't know if you know who they are. Maybe it would be a better thing for people to be directed to those organizations that are getting this money from either the state or the federal government, and then with the promise of distributing it to organizations like yours, but are definitely not doing it due to all the red tapes that they put in place.
I feel like I heard a couple different things here. So right now, the fund sits with the nonprofit lenders, preferred lenders through deed. They already have decided who those folks are. It's about 23 of them. That information is available on the deed website. Some of them we have relationships with, like ADC, NDC, AEDIS, and others are on that. And for as far as I know, none of the folks that I've helped apply for those loans have been able to qualify. They've all been denied. Some of them is due to their industries were left out of the executive order. Industries such as travel, boutiques, clothing stores, food trucks, caterers, a lot of the consultants, social enterprises have been left out of the order because deed is very specific. And then SBA is due to the fact that they are not up to par. They're asking for financial information, bookkeeping, accounting, and a lot of stuff that our businesses are not readily available to be able to apply and be able to access some of these funding. So hopefully I answered your question as far as who the lenders are and what are some of the barriers that the businesses have already faced. I don't know anybody that I've helped. People haven't gotten a no from SBA, but they haven't gotten any response. And I don't know anybody that I've helped that have applied for the deed loans that have received it up to this point.
So what role do you want the council to play in this?
So what I'm asking the council to do is to support our petition, which is advocating for a separate pot of money. Right now, there's $30 million out there to these various nonprofit lenders that we do not have access to. We want a separate pot of money. I asked for $1 million. I know it's small, but we wanted to get the ask out there. And as more we're talking to the business owners, the $1 million is not enough. That money does not come to Acer. It will be sitting with our nonprofit lenders to be able to, but what we want to do is to be able to be a part of that review process, the application process, to make sure that our businesses are really the ones who are going to get that money.
So Wayne, you have a quick question because I just got word that the commissioner is on. So if you want to ask your question, and then I'll move back to the commissioner, and then we can go back to public comment.
Well, yeah, I think the treasurer asked the question as far as what Denise, we appreciate the work that you do, and thank you for sharing that. I think we all have a level of understanding as far as how African businesses, at least, will struggle more to qualify for those stimulus loans and offers that are being given out there. So it's important to be able to design something that fit the micro businesses that we are part of. So I want to thank you for that, and the fact that I think council members, as we are aware, I think it's important for us to show support for that kind of initiative, because it's going to help a lot of businesses that fall within groups to which we belong. So I just want to express that we show some support, and if it means that we collectively maybe pass this just to support the initiative, then I think we can put it to a motion, have a vote just to support it. But I don't think I don't know, Denise, whether did you share the petition with everyone or?
No, I'm going to send that now. Is there somebody who I should send it to quickly?
Yep, send that to Shakira.
Okay.
Right.
Thank you.
So we can just see the language of the petition, and I think just to express support for the initiative, then definitely is going to help those who we serve. Thanks.
Thank you, Denise.
Thanks, everyone. I appreciate it.
No problem. So I'm going to stop public comments for right now, and I want to welcome our special guest, Commissioner Jody Harpsted. She is the Commissioner of Department of Human Services. And we've asked, and just as more for community members, we had a conversation, I would say probably early on, well, towards the end of last year. And we've been, as of January, we've been inviting different commissioners to come and share a little bit about their division, and then also share about information where the council can either support the endeavors and the work that they're doing within their division and their unit, and or we can also push resources that they may have available for our constituents to be able to tap into. So Commissioner Harpsted, thank you for joining us, and I'm going to turn it over to you for your presentation. Or is she on mute? I think you're muted. We can't hear you. I hear you a little bit. You just sound faded.
Just put your volume on louder.
Are we good?
There you go.
There you go. Now we can hear you.
It helps to turn it on. So well, thank you. Well, thank you so much for the invitation.
Is the camera on?
It's good to see you and have someone to talk to other than my own staff every day. And so,
Commissioner, your volume is still too low.
really?
Yeah.
Can you hear me now?
Yeah, that's way better.
Is it?
Yep, it is. And then I would say without everybody else, if everybody else can just mute their phone so we can hear her as well.
Okay.
Perfect. And if there are questions that come up before I turn it over to you, Commissioner, please use the chat and we'll try and address those that way. Okay, go ahead.
Again, great to be with all of you, even though we're together in an odd way here. And good to see you all. So my whole job has changed since COVID sent us home. Of course, you probably know that the governor signed an executive order giving us the opportunity to change rules and regulations in ways that help our providers out in the community continue to work through this time, especially remotely. One of the first things we did was to make sure that no one was taken off of Medicaid or Minnesota Care Health Insurance if they were on it at the time this all started. So we have stopped re-enrolling and recertifying people for Medicaid and Minnesota Care Health Insurance. We're keeping everyone on it through this emergency. We've also made sure that nobody was going to drop off of MFIP or SNAP food benefits or several of the other cash assistance programs that we have. So we're just keeping everyone on through this period and not recertifying or re-enrolling people in a variety of benefits. You may have also heard that we've done a lot to make sure that people could do, for example, mental health services via telemedicine. And we're doing a lot more work, obviously, remotely. And so we've made sure that child protection workers have a way to continue to do their work remotely. And a whole variety of other medical professionals, behavioral health specialists, and others are able to continue their work in a whole new remote way. We've passed 30 different decisions to help people keep their work going through COVID. They are all posted on our DHS website under waivers and modifications. So you can see all the things that we've done to make it easier for people to continue to support the people we support in community while we're getting through this COVID emergency. So that has completely consumed our time for the last, I would say, 3 weeks since we all went home and started to work remotely. One of the things that we were talking with the council about before all of that happened was family preservation. And just in case you're not all in the same place on that, we worked with Representative Rena Moran and Senator Hayden to make sure that we understood what the community was looking for in terms of family preservation. And Representative Moran got a bill introduced into the House with several elements to support family preservation. And we made sure that that bill was in the governor's budget. And then COVID happened. So as you know, the legislature right now is only working on COVID funding and bills around the COVID emergency. We are hoping that by the end of the session, they get back to some of the things that were in the original budgets and the original bills that were introduced at the beginning of the session, and that there's still a possibility for the family preservation bill to pass. So we're eager to see that happen. I'm pleased that the governor's team has pulled together a work group between the Department of Human Services and Minnesota Housing called the At-Risk Populations Work Group. We're particularly focused on making sure that older adults, people with disabilities, and the homeless right now are getting access to masks and services, that we're housing the homeless as much as possible, and we're making sure that seniors and people with disabilities are protected and able to access services throughout the emergency. We've been working on the decisions that we've made in the Department of Human Services with a small group of senior executives from DHS, which every time include our Chief Equity Officer, Dr. Karen McKinney, who joined us right before the session started. And so she's looking at every single one of our decisions through an equity lens. And she just came to state government from the community, so she asks very tough questions. And we're really pleased that she's with us. We've learned a lot, and we're all talking about how we can make a difference in the community overall and after COVID, excuse me, through the decisions that we're making right now. I would be interested in any questions you have that I could answer.
Are there any questions for the commissioner? And I know, Commissioner, I'm getting text messages where some people are saying your volume is still, it's coming across choppy.
I don't know what else to do about that.
Yeah. Any questions for the commissioner that you all have for her?
Yes, Madam Chair, this is Carl. I'm wondering what data is being gathered about the impact of COVID on Black and brown people.
Yeah, I know that the governor's office particularly has worked on some of that information. And we're looking at adding another work group, particularly based on equity and communities of color. And so we're eager to put together our work group for at-risk populations with the work group on racial equity to see what else we can learn from that. We're also eager to see how much we can shine a light on populations that need our support now, so that we can continue to shine a light on those populations after COVID and see what we can do to keep equity in the community after this all ends.
So I'm going to read a question from one of our council members. She says, Commissioner, thank you very much for your work during this COVID-19 time. We appreciate the work to help maintain some resources of support for our people. Before this happened, however, there was a huge loss of revenue given to the Indian population, which cannot be accounted for. Are there any efforts being made to get to the bottom of this huge disappearance of funds, and the state's offers an account for the taxpayer public funds?
We spent all afternoon on that actually today. And we're getting to the bottom of that, getting ready to pay the feds back for the overpayments that happened a year ago, and working with the tribes in consultation to figure out how we're going to get through this whole thing, working with them. So yes, we're still working on that even through this COVID time.
Any other questions for the commissioner?
I have one, Commissioner. Thank you too also for your work. My question is, what is the department's position on distance healthcare consultation with regards to HIPAA? Is there any specific that, healthcare services can be done by Zoom or Google, or is there any particular position of the department in terms of using those different mediums?
That's a good question. We have not done that. We have talked about allowing for payments for remote mental health, behavioral health, substance use disorder treatments, but we haven't specified the remote medium. That's something we should probably go ask about, huh?
Yeah, I think, because most people don't want to go to the doctor, of course, in person. So if they're gonna chat with the doctors, how are they going to do that, and how is HIPAA going to play into that, so that information is just given out?
Right. Well, we have allowed for all kinds of telemedicine across all kinds of specialties, but we haven't specified, what particular software that people should use. Was that your question? And whether some of them are protected?
Right, exactly. That was the question.
Yeah. That's a very good question. We were just warned today by the IT department in the state of Minnesota to be careful about Zoom when it comes to private information. And so that's something I do want to go ask some more questions about. Thank you for bringing that up.
You're welcome.
So one of the questions that I have, and Georgette, I see that you're typing something, but it hasn't come through yet. But one of the questions that I have is, I know when you're looking at some of the career force centers, some of them have opted to close, and I know some were kind of doing a dual role where they were doing workforce initiatives, but they were also able to come in and get services provided by DHS, so mainly social services. So how are you all addressing that with COVID-19 and knowing that a lot of the services or the help around the services is being delivered virtually? So what are you all doing to ensure that if somebody needs to come in and talk to a counselor, then how are they handling those right now?
We're pretty much letting the local sites figure out how to do that and to tell people how to find them now that they are unable to come into offices. And so I'm not sure about the kinds of services that people were able to access in workforce centers. I know a lot of people are still getting to county offices or just contacting people online. And we're finding all kinds of ways to find each other now on the internet and call-ins and that sort of thing. So we're not absolutely sure, though, who can't find us. So that's a good question for us to follow up some more on.
And mainly why I'm asking that is because I know that there is, one of the concerns, obviously, is transportation. So just making sure that our Black and brown folks, to be honest and be frank, are able to access the adequate services that they need, and ensuring that that they will not experience as harshly, I'll say, food insecurities and so forth like that. So that's good to know.
Right.
2 questions. So Justin, I saw your hand up. Dr. Lawson also has a question, and then I'm going to read something from the community.
Yeah, Madam Chair, Thank you for a moment. Commissioner Harpsted, first, I just want to say thank you for working with the Council on the African American Family Preservation Act. You know, we're excited to get some movement on that bill and some of the things that got done last year. I think when you were talking earlier, that your mic was breaking out when you had talked about some of that stuff. And also, just going back to that data question, I think that a question about, which I know you didn't come with like hardcore statistics or anything today, potentially. You don't have a present PowerPoint, but I was just wondering if you talk a little bit more about the Governor's Council on COVID-19 and strategies to move resources into our constituents' communities.
So there are efforts going on in every agency of state government. We talk to each other every morning to compare notes and talk about who's doing what. And so there's a lot of interest in making sure that we're coordinating and communicating and covering all the different communities. We've raised issues this morning about rural communities. We've talked about communities of color. We're making sure that our tribal nations are covered. We've been making sure that people in different languages can access the information that we're putting out there nowadays. We're making sure that the deaf and hard of hearing community is able to access information and services. I think we're doing more communicating than we've ever done. I know we're doing more communicating with each other across state government than we've ever done. And I hope that's translating into people out in the community understanding what's going on and how to access services.
Dr. Lawson, you had your hand up as well. Do you have another question?
Yeah, I do. Yeah, thank you very much, Madam Chair. Commissioner, I am just wondering whether there is any discussion out there. I know that the governor has pushed the order for schools to get back in session. Well, they are going to lift it May 13th. And I'm getting kind of questions from families asking whether there will be any testing of educators or students before, you know, school starts, the face-to-face interaction starts. I discussed that with some of my administrators and they're like, okay, it's really the state's responsibility to do that. Parents are worried for obvious reasons. Teachers are also, we're all worried. So we're wondering, because at one time they said anybody who wants to be tested could get tested, but you know, that's not the case. So are you prioritizing who gets tested? Because I think that parents would be more comfortable if everybody working with their kids in that close quarters were tested before they even send them to back to school on May 13th, if that's what the decision is.
Yeah, I don't know the answer to your question. I can check with the Department of Education about that. But I do know there's a tremendous shortage of testing kits. And it's been hard to test all the people that we've wanted to test in Minnesota in any place. And so I don't know that we would be able to make sure that everyone was tested before kids went back to school.
Okay.
So I do have a question from the community. This question says, thanks for your hard work. We are getting concerns about people being afraid to go to the hospital right now because of how they are being treated at the facilities. So I don't know if this is something that you can address on your end of concerns that you have either have heard or how it's being handled.
Is this is for something that's non-COVID, that people are afraid to go to hospitals? Do you know?
Georgette, you want to respond to that? So you posted this question.
Sure, I think it's COVID related and other issues. People are going to hospital, and I understand that you're not allowed to enter the facility with a relative or so.
Yeah.
Some people, there's a lot of emails or messages coming up from people going to hospitals and being treated as they have COVID when they actually went to the facilities for completely different reasons.
Okay.
And, those concerns are popping up all over. And with that, when you talk to people that may be affected or having symptoms, they prefer to stay home and try to self-treat themselves and may end up at facilities at when maybe the symptoms are really severe. So I don't know what's happening there, but we are getting a lot of concerns in the community from people being afraid to go to the hospital, thinking they will get the virus from the hospital, actually.
Yeah, well, that's a very understandable concern. I know I had a favorite aunt who went to the hospital in very critical condition last week, and her son couldn't go with her. She just had to go alone, and she decided to do it anyway. It wasn't for COVID, it was for something else. But it's heartbreaking when family can't be there together. At the same time, we're trying to protect the family from catching COVID as well. And so I appreciate those concerns. And interesting, these days, I did see a notice from some hospitals who said, if you have other symptoms like heart symptoms, please come in. We will make sure we treat you as well. And it's not just COVID right now. And so don't delay coming into the hospital. But of course, people are afraid. And that kind of messaging can help, but it doesn't allay everybody's fears. And yeah, it's a great concern right now about anyone that needs to go to the hospital. And of course, people should continue to follow the same kind of guidelines they followed before about whether or not they went to the hospital when they weren't well, but it's harder to do right now when people are so concerned. But I'll take that concern back and talk to the governor's staff and others about the fact that that's happening. Appreciate it, hearing it.
Council members, are there any other questions for our commissioner? Go ahead, Jude.
Okay. My name is Jude Nadi. I'm a council member. I live in Brooklyn Center here, and I live with a lot of African immigrants here. So before COVID came into full force, we know that in our community, there are a lot of HIV/AIDS issues. And even when we have test kits, people, because of cultural issues and some other challenges, they don't take advantage of that. So we're looking at states, stepping into putting more resources to help out, reach out to folks in that regard. That's just one thing. Maybe I know that COVID is taking a lot of oxygen in our community, but after that, it's something that we might look into later. So that's one question. And then another question is an issue I know within our community. I'm a member of Knights of St. John. We have like 30-something members in that group, and up to maybe 3 to 4 people have had stroke in the last 3-4 years. So this is not scientific, but from experience, it's pretty common in our community. And it's something that, beyond an individual can do, something that the state may help out to look into the data and how to help out in that regard. So we have organizations helping out health-wise in our community, but within a nonprofit and within our cultural organizations is not enough to tackle some of these problems. So it's something that I will connect with you, your office later to give you more information. We can't, I know we won't be able to discuss all this here within this period of time.
Thank you for that. It's helpful to hear these stories. Thank you.
And then I do have one other question that was submitted in reference to the hospital visits. It was, what do they do if a family member is also their translator? Will an exception be made?
That's right. That's a very good question. And I don't know how well we're doing keeping translators in hospitals these days. The health systems were getting better and better at having translators engaged in their work, but I haven't heard about the level of translation available in hospitals today as people have to go in. And so let me look into that.
Okay. And I know at the beginning, and a couple of people have texted me on this, at the beginning, because I couldn't quite hear what you were saying, one of the council members asked, are you willing to, and maybe Tawana, you can speak to it, you were asking her to repeat what she had said at the very beginning. Was there something specific? Because I know one of the things that we do know is in reference to the African American Preservation Act. And I can't recall if you really spoke to that and what your position is and how that really will impact our community. you know, for us to be able to have obviously our own. So I'm just wondering about if that was something that you had kind of spoken to a little bit. And then Tawana also, Councilmember Mullins, if there was another piece that you wanted her to speak to.
No, I really couldn't hear anything, and I was just afraid that I missed something important that she said.
But let me repeat that if I could.
Please do.
We've been working a lot with Representative Moran and Senator Hayden on elements of the Family Preservation Act that we could help forward this session. And so those different pieces of that were narrowed down to about 5 key elements that they thought were the most important. And Representative Moran introduced a bill with those pieces in it. And we made sure that bill got into the governor's budget. And so we've been wanting to work with her throughout the session, and also Senator Hayden, to get that passed, and now everything's COVID. So we're still hoping that at the end of the session, some of the things that were in the governor's budget and some of the things that other people introduced will still get some hearing and still have a chance to pass. We'll just see how it goes. As you know, we're making this up as we go along at the legislature. I've never dealt with this before. So we hope that that bill comes up again before the end of the session, and at least some of it passes, if not all of it.
Okay, perfect. Carl, you can go ahead and ask that question that you posted.
Thank you, Madam Chair. Commissioner, there's been talk about using our cell phones and telephone devices, working with Google, to track whether people are going to get a program that says you've been in contact with someone that has been exposed to COVID. I'm really concerned about that as far as civil liberties and other liberties that may be violated or pushed farther because of this pandemic. And I want to know if those talks have been happening in Minnesota, and if so, what could be our role at the table in those conversations? Thank you.
Thank you. The one thing we've talked about in Minnesota is an app that was created to measure symptom tracking. So if we were to advise all nonprofits and care settings to check people for symptoms when they come in every day, it's a handful of simple questions, and it's a thermometer check. There's no name associated with it or any other demographic information. And it would just be a way to see if everyone is checking symptoms as we ask them to. And we could measure that and draw maps of it and understand where there might be hotspots in Minnesota. But there's been rigorous debate about whether to do that in Minnesota, and we haven't come to a conclusion. We think it might be a tool that will help us go back out into the community as long as we're at least testing symptoms. On the other hand, there are privacy concerns and just concerns about what we would do with that data even if we had it. And so it's not at all clear right now whether we're going to move in that direction in Minnesota or not. But if we did, none of it is connected to people's names or numbers or social security numbers. There's no way to identify the people in it.
Thank you, Madam Chair, Commissioner. My concern is, as you see nationwide, the pandemic has forced things in China where they now have signs in McDonald's saying no Black people are allowed, because the connection is coming up that we have a higher risk of COVID. And I don't want to see that happen in our community and in our state. Thank you.
We don't either, but thank you for that feedback. And I'll take that back into that conversation about that tracking app. Thank you.
Are there any other, I don't see any other questions posted here. Any other questions from the council members?
Yeah, this is Mustafa. My question is about Somali childcare centers. I know there's been a lot of issues with that, with the Somali childcare centers in the past couple of years, and issues around compliance. So I'm wondering how things have been and if there are ongoing efforts to like make sure everyone's in compliance and whatnot.
Yes, there are, and we've really gotten that compliance very much in shape. We put some really strong tools in place in that area and made sure that we are able to track very carefully what's going on in all child care centers. And We've also done a lot since COVID to stand up a lot of extra dollars and supports and flexibilities to keep childcare centers open during this COVID time. So we're both being very supportive of childcare centers and helping them flex the rules so they can stay open, but continue to investigate if there are problems. And we've done both at the same time. Thanks for asking about that.
Any other questions?
Yeah, sorry, it's just a clarification question, Madam Chair. Commissioner, if we're collecting this data and it's non-identifiable, it's totally unanimous and all that, what then is the purpose for collecting it? Because I don't see how you can use it if you can identify, you know, issues or people who may have it.
Right, part of it is to see if there are any hotspots in Minnesota that we need to pay particular attention to. Part of it is if we have trained people, for example, in a skilled nursing facility to do symptom tracking, we can see if that facility is doing it or not.
Oh,
so
okay.
we can check compliance with symptom tracking. It's never been the purpose of any of that to find specific people. But I can also tell you that our equity officer, Karen McKinney, raised the same question about some populations just being profiled using it. So we would want to ask those questions before we went ahead and used that app, but it's not at all clear yet whether we're going to go in that direction.
Okay, thank you.
Thank you.
Any other questions from the council members and or staff? Okay, well, Commissioner, thank you so much for taking time out of your evening to come share what DHS is doing and being able to answer some of our questions. You're welcome to stay on, or you can jump off the call.
I'll have to go. It's been a long day, but I want to thank you for the invitation. Just knowing what questions you have on your mind is extremely valuable, and I will take these questions back into the daily briefings with the governor. So thank you very much for the time tonight.
Absolutely. Thank you. Have a good night.
Okay.
So I will turn it back and reopen it back up to our public comments. Do we have any public comments? I know we heard from Denise Butler. Was anybody else on the call? Did you have any comments that you wanted to make? So seeing none, I'm going to keep going with the agenda. So can we move to
My hand?
Yes, Jude.
Okay. So I wanted to portray what Denise talked about because we live here in this community. We know that lots of people, small businesses, they are not getting some of the stimulus package being dished out by the state and federal.
Mm-hmm.
So, it's something that apart from signing the letter that Denise is sharing now, something that we need to step up more action, because at the end of the day, if like I live in Brooklyn Center, my city, we have people of color, 90% of us doing businesses. We don't have a payroll. And most of this stimulus is towards payroll. So since we don't have payroll, just like less than 10% could be like one or two or three employees. So the money coming to the community is so small. At the end of the day, the federal government is spending $4.3 trillion. And then if we don't get much share to the community, it's still going to impact us and create more poverty within us. So it's something that, because of the crisis, I really wanted to talk to Justin, the ED, but I was so busy with this crisis, but I'm still going to talk to him. And I also want council members to weigh in on this case, because the more we are left behind, the more poverty we're going to have within the community, and it's going to impact us more. So it's critical that we take this serious. In fact, If I had put my things together, it would have been part of our agenda. But I should blame myself on that. But going forward, since COVID is still within us, it's something that we should take more energy and see how this is impacting us economically. And also, like what they have in DEED department didn't help us at all. Because once you look at the eligibility, we are working with ADC, and this ADC said, if you check out and you don't qualify, there's no point wasting time because you are taking the time for those who qualify to apply. So I have small business, my wife has, other people I know, none of us qualified the way it was written. So coming from the state, the $30 million is almost non-existent. And then the one from federal, the same case. So we are smoked, seriously. And we should do something beyond what we're talking this afternoon. Thank you.
So it sounds like you need to have a conversation with Justin. And Justin, you have your hand up. Go ahead.
Madam Chair, I want to close up because
hold on, Wayne. Justin had his hand up first.
Oh, okay.
Go ahead, Justin, and then Wayne.
Madam Chair, I just do not talk a little bit about this earlier today. This is something that's on our radar. Amber will highlight some of the things we're tracking later in my report. But the one thing I want to say is that we have reached out to Hamza and Steve Grove from the Commissioner of DEED to join a council meeting. And so hopefully Jude will be able to raise some of these concerns with Commissioner Grove and Deputy Commissioner Warfa directly.
Go ahead, Wayne.
Yes, Madam Chair. I think in the past, the role of the council, we had 15 community members who came to the council and articulated some of the work they're doing and asked us for support as far as a body. And as we all know, COVID came upon us. There's no particular strategy we had in place. And I'm sure going forward, we talk about discussing that. But I think it's important for us to show support as a body. And I don't think anybody would disagree that initiative to find some type of funding that would support micro businesses that affect our community the most, that we should be able to support that initiative, not by only signing a petition, but just as a council maybe put in a motion to support the initiative that it happens, that we are with the community in that effort. So if anybody can weigh in whether you want to do that or not, but I think the question was, what can we as a council do? I think the least we can do is just put it to a vote to support the initiative.
So I will say this, and I think that's why we had that petition been sent out to us. I don't think any of us are against supporting the initiative, but I think what the ask was, what I heard was that we sign on the petition, and a couple of people raised that. I think Dr. Lawson raised that, and then Carl also raised that in the chat. And so I think we're all for that. I'm going to echo something that Justin said, and we just talked about this last Tuesday, is to have the commissioner and the deputy commissioner potentially come for next month, and be able to address some of these direct issues that they're raising in reference to how are they supporting entrepreneurs, small business, micropreneurs, solopreneurs, and specifically that are really around the African heritage community. And I think the other piece, though, that I would encourage us to do as a council body is if we have ideas, that needs to be comprised. And it sounds like I heard Justin mention that, with now Amber being on board and her being our outreach coordinator, there's going to be some things that she's already probably putting together or going to put together. And I think once we see that aspect, then we can be able to move forward. But what I don't want us to do is, kind of act as an octopus and have, just have stuff just everywhere, but really kind of holistically, how do we approach this so that we're coming into it from a collective impact? And so I think once we see what Amber's putting together and then taking into account what we heard directly from a community member, what we directly heard from Jude, our council member, and then also some of the things that you're raising, then we would be better positioned so that when they come in May, we are better positioned to really bring what our ask is directly from them, from a funding perspective. And I don't think any of us are against signing on for the petition, but I think the one thing is we need to see it before we, make a vote and say, yes, let's sign onto this petition when we haven't actually seen what the petition is stating. Is that helpful?
Yeah, I mean, that's helpful. Granted, we're just getting it today. But I like the fact that, a strategy for May will be to get, those commissioners in so we can have some of those conversations.
Yep, and I gave Shakira their admin support, like who their direct contacts would be to be able to make that happen.
Okay.
Justin, I see your hand up.
So, Commissioner Shakira just let me know that Commissioner Warfa and Grove are both confirmed for next month. And so we're still waiting to hear back from Commissioner of DLI. Okay. And then I did want to say something on the subject of Denise's petition. I had a question first, like how many people have signed on to the petition, and because I would say that if the council wants to sign on to a petition, I think that's great. I would say, Denise, you and I have been in the trenches together enough for you to know that, like, I'm happy to be a co-conspirator on any strategy that you guys are moving at the Capitol. And so I was happy to get the petition, but frankly, like, we're here every day. Like, there's nobody that can get away from us. So I'm just joking. That was a joke. But we're here every day, and so we do have access to the to the legislators, and so we would be happy to be somewhat of a co-conspirator as you are one of our constituents. So.
And Jeremiah, I saw your hand up since we still are on public comment. You have to unmute yourself.
Hello, Mr. Chair. Thank you for the opportunity, and I'm happy to be here tonight. And I have a question. My question is, every community has some uniqueness that makes that community strong or weak. How this council reach out to those communities, understand those communities, the community's opportunity and challenge that may help this council more stronger, or this council makes more successful. Thank you.
You know what, you cut out, so I didn't hear that last piece of what you said.
How this council would reach out to communities in the state, identify their challenges and opportunities, and use those resources to address their problem, or even build this council to the next level it could be.
So I'll answer that. And Jude, I see your hand up, so just 1 second. So let me just kind of step back. So as you know, we're all appointed from the governor. And part of our roles that, with that appointment is really, looking at your own ethnic background and being able to tap into your own network. But then also we now have an outreach coordinator, but we also have done in the past, when we did have our outreach coordinator, which was Patrice Bailey before he left and went over to the Department of Agriculture. And we also have Jasmine Carey, who is our legislative coordinator. They actually do outreach to the community. So we have hosted various events around the state. One of the other things that, our plan and our goal is that we have to reach back within our own constituencies and find out what some of those issues are and bring those forward. There were several things this last legislative session that really got passed, and it was at the work of, I would say, the council for a lot of things, a lot of bills that, were heard, a lot of bills that were passed that we either signed on to or supported. Justin and his team have been instrumental in making sure that they have the governor's ear. There are various tables that we all sit at So it's not just your work that you're doing right now at the council, but it's also what work are you doing outside of this. I look at even myself, I sit on several boards, it's not the only one, but as I'm listening to what is happening within my own African-American community, I'm bringing that back. You know, and I'm sure as well as I'm looking at, you know, some of my West African, you know, council members are doing the same thing, and our East African council members are doing the same thing, where they're, whatever they're doing within their roles, and whoever's within their network, bringing that information back in order for us to get back to what some of the core issues are. When we had our day on the Hill, some of the, I would say some of our core areas are probably no different than, you know, some of the other communities of color, is looking at education, looking at economic development, looking at workforce. You know, one of the biggest ones is reparations. I mean, so how are we looking at these items and being a community? So it's not, you know, it's not like we actually have the financial capacity to put funding means behind certain things, but we absolutely have the capacity, as far as human capacity, to reach out to the right constituents that would be able to support the council on the endeavors that we're trying to do for our Black and brown folk. Jude, you had a question, you have your hand up.
Yeah, it's just following what we discussed earlier. So by the next month, because of the changes happening because of COVID, a lot of changes happen within days and hours. I will be coming back here. I'll be talking to Justin because we have a request of $20 million for people of color, low-income community who are not taking some of the stimulus happening now within because of COVID, small businesses. So I'll be working with Justin and the staff, and luckily Amber Jones is coming up to help because this is big to us. It's a big thing to us. So it's something that we really want to give it the best we can because we know after COVID, the impact will live with us years, or possibly hundreds of years to come in our community.
Okay, thank you. Any other community comments before we move on? All right, thank you for that. I'm gonna move to our standing items. And basically it's Justin and team to take us away. So we're looking at and I'll just name them. You don't have to put it up, Shakira. I can just name what they are. So we're looking at 2 items, which is the strategic planning session and then the director's report.
Madam Chair, I'm excited to welcome Chris and Karen DeYoung to the call to talk about the strategic plan. I will turn it over to them to offer a report on where they're at.
Yeah, thank you so much, Justin and Madam Chair. We are excited. Thank you. We are excited to have an opportunity to give you a brief report about what we are doing, where we are in terms of the plan, the strategic plan. Can everyone hear me? I can't tell if, okay, great.
Yeah, you sound good.
All right, so am I able to share the screen? Does someone need to give me that ability, or can I just do it on my own? Okay.
Here, you would have to allow her to share if you set it up that way. Yeah. And then I would ask, if you're not talking, if you, just so we don't hear background, if you all could please mute your
All right. Okay, thank you, Shakira. So we just have a brief overview. I'm gonna have the first thing we're gonna talk about is the interviews that have been done to date. I'm gonna turn that over to Chris to talk about that for just a couple minutes. And he may need to be unmuted as well.
Can everyone hear me?
Yes.
Okay, perfect. Thanks for having us. Glad to be here. Just wanted to go over the interviews that we've conducted. We started off with 2 leadership interviews with Narita Hughes and Justin Terrell. Then we went on to have a mixture of internal stakeholder interviews and external stakeholder interviews. As you can see, we've listed off all the internal stakeholders: Carl Crawford, Wayne Doe, Tawana Mullins, Mustafa Jamali, Dr. Fatima Larson, and Jude Nadi. So far, of the external stakeholders, we've had Sierra Herr, with the Executive Director of the Council of Pacific Asian Minnesotans, Tracy Sigstead, the Director of SMART, Representative Rena Moran, Greg Hubinger of Legislative Coordinating Commission, Kellis Houston, founder of Village Arms, and Marcus Owens, the Executive Director of the African American Leadership Forum. We currently have 3 additional interviews left to accomplish. As of course, with the COVID-19 epidemic going on, it's become just a little bit more difficult to get some of these interviews going on. Everyone has a lot going on because of the COVID-19. So we've just been trying to work around people's schedules and trying to make as many adjustments as possible as we go on trying to do the additional interviews.
And so just as thank you, Chris, just as a reminder, this is part of the environmental scan where we talk to internal and external stakeholders and ask them about, to what degree is the council achieving its mission? We ask about any perceived trends that the council needs to be concerned about, strengths and opportunities, partnership. So the questions will be slightly different for each. There were some overlapping questions, but there were other questions that were specific to external stakeholders, for example. And then just some high-level initial findings. And as I say here, we don't normally like to give any kind of findings until the analysis is done and we have done all the reporting, but just some very, very high-level ones. So generally a sense of the council being on an upward trajectory in terms of leadership, its role in the community, and the role of the board. But some did believe that its past reputation can still be a hindrance for moving forward. And there were a sense that there is some internal interpersonal tensions that exist, and that the council should play a role and externally in bringing communities together. Some of the things that have been discussed tonight: the council should strengthen its connection with the community, both in terms of understanding the needs and creating an awareness. There's a sense that people don't know what the council does. And this is particularly important given the impact of COVID-19 and that it's having on the Black community. And then CMAH has the opportunity to bring in more resources by being a real player at the table and leveraging real power. And so what that would look like, these are very high level findings. The actual report that we'll put together will be much more comprehensive. It'll be broken down into categories, but again, we're still still analyzing. I think we have 4 more interviews to analyze, 3 more interviews to conduct and then analyze. So this is just a quick pass at what we have so far. Just in terms of next steps, we'll complete the interviews and our data analysis and reporting. And of course, given the COVID-19, we talked about, normally you'd have like a 4-hour in-person retreat. That's not feasible, obviously, at this point. So we thought about doing a 2-hour online Zoom-based retreat, which would be primarily focused on, here are the key themes that came up and findings, and some visioning. So one of the other things that isn't in this list above of findings is there is some disagreement about what the vision is for the council. So given everything that we've heard, what can we collectively come to a vision of what the role of the council would be, and also looking at the findings, and then having a second, hopefully by that point, in-person meeting where we start to draft goals. So yeah, normally you would present the information and then people will collectively say, what are the different areas, what are the strengths and opportunities that the data is showing us. And so given that, what are the different goal areas that we want to focus on? And then you go from your larger goal area to your strategic priorities to goals and then actions. And so I wouldn't expect to at those two meetings, we'd get to the level of the activities, but we could certainly do looking at the data, coming up with what are the strategic priority areas? For example, that could be, council development, or you could have something specific to COVID-19, for example. And then some goals, and then we go back and forth probably in terms of the specific strategies. And do people have, well, I should turn over to Madam Chair, I guess, to see if people have questions.
Yeah, and I do have a question. I'm looking at who has been interviewed, and have there not been any constituents from East African or West African represented? Because I'm concerned by that, when we are looking at this from an African heritage, but I'm seeing more African American, stakeholders that are listed from the external perspective.
And I think I'm going to turn that over to Justin. I don't know, Chris, if you have feedback on just the process of who was contacted and who was available, but we were given guidance, I guess, in terms of who we should interview.
Okay.
So what kind of guidance were you given? Oh, just a minute. Justin,
can you respond to that, please?
Yeah.
Yeah, I'm happy to respond. So the goal was to do 15 interviews. And so if you look at the list, the list is, it's Narita, it's myself, it's Carl, it's the council members. And then outside of the council members, what I did is I selected folks who we interact with on a regular basis. So, our list obviously is thousands of folks. We touch people in multiple different communities, not just the East and West African community, but we also talk with folks in the Sudanese community. We talk with folks across the board. The folks I selected as external stakeholders were the other two executive directors of the Ethnic Council. Sia did her interview. Rosa was not available. Tracy, who is in SMART, SMART is the agency that works with our budget. I feel like her perspective is very valuable. Representative Moran, who was a member for a full term, for a full 8 years, and Greg Hubinger at the LCC, Khalees Houston, who was the leader on the African American Family Preservation Act, Marcus, who's at African American Leadership Forum, who we work with a lot. And then the other three folks so Rosa was one who didn't do an interview, Senator Hayden wasn't able to do an interview, and Representative Noor was the other one who wasn't able to do an interview. So in general, I wasn't really looking at an identity as far as just getting general perspectives from different communities. Is really more about who are the folks that touch this work on a regular basis. And right now, it'd be easy to reach out to, the NAACP in St. Paul and ask for help. She was on my list, and I had a much more expansive list that is far more diverse, but narrowing it down to 15, these are really the folks, specifically, Khalees is leading on our top issue from the community perspective. And then the rest of the folks on the list are all, folks that we deal with pretty much on a daily basis. So the goal when I set up this list wasn't necessarily about representative input from different parts of our constituency. Is really about the work of the council and how we function on a day-to-day basis, right? And so we do have some new appointments coming on the board because they would have been included in this as well. And then as far as the folks who work on our budget, the folks at the LCC, it just so happens the African American Family Preservation Act is an issue we've been working on for multiple years now. And so that's how the makeup of this was designed. We do have 3 more interviews to do. So if the council would like me to make sure that those are from more diverse perspectives, I'm happy to do that.
Okay. Go ahead, Dr. Lawson.
Yeah, I was just thinking that would be better because if the goal is just to work with people who already know our work, then we're not growing. We need to check, we need to communicate or hear multiple perspectives so that we can have, balanced feedback about how we're doing as a council so that we can improve our work and our practice and our impact in the community. So I think it's a good idea to expand, the 3 remaining interviewees to other communities so that they can also feel that we have good representation from external candidates. You have other executive directors, and then we have legislators, we have Greg Ubinger. So I think we have enough from internal. We probably need to expand it to have, I don't know how you classify the 3 that are remaining, but it would be important if we could tap into other communities so that they give us input and help us get a more robust report and direction as to where we need to go as a council.
Madam Chair, if I could.
Yep.
The caveat I would give with that is I would select people who, they have to know the council, they have to know the work of the council. Otherwise, they're not going to have. I mean, they can talk about needs in the community in general, but the idea really is to reflect on the council itself and the role of the needs in the community. So it'd have to be. And you can certainly broaden it to more diverse communities, but it should be people who are knowledgeable about the council, because you are reflecting on the council as opposed to a regular. It's not a community needs assessment. In other words, where you go into the community and you're asking what are the community needs. It's more putting a mirror up to the council and getting feedback, if that makes sense. So broaden, yes, but certainly there should be people who know about the council.
Well, for the most part, the other communities. Sorry. I was just going to quickly say that the other communities really don't know much about the council because we've not been reaching out to them. So if the goal is for us to just hear from people who already know what we're doing, then I don't know how we're growing.
Well, let me just add my voice. I think one of the words I heard in your presentation was that the impact of the council. So, I mean, the impact of the council can be that people who just don't feel the impact at all. So you want to make sure that you have those voices also. So it's important, I think, if we can include that, because I can guarantee you may go into communities that people hear about the council, they don't know about it, but they know that the impact of the council is not necessarily, positive or negative, but somehow. I think it's important for us to get those voices as well. So it wouldn't, I don't know how much is gonna deviate because you used the word impact of the council. So I think we should tap into those communities that probably have their own version of what the council means or what we stand for.
So here's what I'm going to recommend is if Dr. Lawson and Wayne, if you guys have ideas, I'm going to ask that you give those to Justin, and then he can pass that on to Karen.
Okay.
Sounds good.
Okay, keep going, Karen.
That was it. So yeah, I said it's a brief update, and I was just opening it up for questions, and that's kind of where we are. So.
You can probably stop sharing your screen because I can't see it. Yeah, if somebody's hand's raised, I can't see it.
Sorry.
No, you're good. You're good. Any more dialogue in reference to what was presented? And let me just kind of share, because I'm seeing some community members' hands being raised. Unfortunately, during this time frame, which is why we have public comments, that is at the point of time of which community can ask questions and raise their concerns at that time, after which we don't actually go back to the community during the meeting, because this is actually one of our regular meetings. But I just want to address that because I am seeing some hands being raised from community members. But just know that I'm not ignoring you. That would be our typical process if we were face to face. But feel free to pose a question in the chat, and we can probably address that at a later date.
Madam Chair, I have one question. As far as timeline, I'm somewhat concerned of trying to have a 2.5 or 3 hour retreat via the web versus missing that opportunity to be in person. So just questioning the timeline. Thank you.
Yeah, and I would agree with that, because I know the contract, if I'm not mistaken, Karen, we have you until the end of the fiscal year.
That's correct.
So I mean, that would be a question whether we as a council decide to say we want to extend it and carry it over into the next fiscal year to complete the work so that we can have a face-to-face, because I would concur with you. I would rather have a face-to-face meeting versus trying to do something, you know, in a strategy setting, this modality. I mean, so that could be something that I think we can raise, and maybe that is a question that the executive team can talk about a little bit. We'll have this is one of our standing items, is the strategic planning. So depending upon where you are, Karen and Chris, at the point of which our next, you know, executive council meeting is, I think that we need to have a discussion at that point in time and then bring it back for a full vote, whether that's an idea for something like this to happen. Because I would hate for us to try to squeeze something that should be 4 hours into a 2-hour segment. And then, you know, the modality of which we're doing is really not necessarily, in my opinion, is really not conducive when you're trying to do strategy planning and when you're trying to move the council to the next level. And I don't want you all to be rushed to try to condense 4 hours worth of work into 2, because this is our new current reality.
Yeah, we were hoping to do, it's still the same thing. I absolutely agree with everything you said. We were hoping to do 2 hours in May and then a face-to-face in June, but there's no guarantee really that we could even do a face-to-face in June. We don't even know where we'll be, so.
Right. Yeah. Jude, I see your hand raised.
Yeah, so I know when we had our interview, the COVID issue was already around the corner. So our discussion, you know, was off chat. And instead of, you know, taking it to the executive council to discuss it, I think if we're going to take a vote, we should take a vote now. But for me, we should extend it by, you know, to next fiscal year. Otherwise, my participation and some other people may not be all that valid in this crisis mode. So I think, I don't know if there's any particular reason why everything will be affected by COVID and this one has to be crammed within this maybe 1 or 2 months. So that's just my contribution on that. I think we should extend it.
Well, the reason why, and I can speak to that, the reason why we're not making that decision right now is because she still has not comprised everything for us. And so it's really seeing where is Karen and Chris going to be at? So where's the Young Consulting going to be at as far as the information that they've gathered after the interviews have taken place at that point in time? More than likely, we won't have that until the executive meeting. So that's my reason for saying, let's have that discussion there and then bringing it back for us, depending upon where she's at in the process. So there's nothing to vote on right now.
Okay, so Madam Chair, even if we don't vote, I'm, you know, from common sense, because of this crisis, I don't think it's something very on our own part very good for us to end this within this fiscal year. So it's something to consider, extend it beyond this fiscal year.
And because we're in flux, Jude, is why we're saying that.
Okay.
Right now, yeah, right now we're in flux, so I don't want to make any brass decisions at this point in time, and we don't know what June's going to look like. So that's kind of where I'm looking at from that perspective. Any other comments in reference to the strategic planning?
So basically what I'm understanding is that the meeting in person scheduled for June may not take place in June, depending on the situation, right?
Correct.
It could spill over. Okay.
Right. Yeah. And because right now, literally, I mean, we know with this pandemic, things are literally changing, you know, on a day-to-day basis. So now we have the May 4th is the stay-at-home, you know, potentially will be lifted. You know, yes, the peacetime emergency is going to be extended until the 13th, but I don't want us to say, yep, let's move it, and then something happens or something's open where we can have the face-to-face. I just don't want us to make that preliminary decision right now. And especially not knowing where we sit with the current process of where she is from a timeline perspective. So we gave Karen and Chris a timeline, And I would like to see, well, where are they at by the time May comes around to make that determination after that point in time. And that's why I'm saying we should wait. If that makes sense.
I think we need to keep in mind too that just because it's lifted in June, that doesn't mean that we jump back into the way that we were meeting.
Right.
You know, it's not like there's a vaccine or a drug that we're expecting in June for all of this to be cleared out. So we still want to meet in a safe way. By safe, I mean 6 feet. You know, because it's just too soon. You know, like we're talking about, you know, May next month. And then a month after that. I just think even if we do have the opportunity to meet in June, I think we need to look at, on a safety standpoint, would it be smart to meet in June that soon, you know?
Nope, I absolutely wholeheartedly agree with everything that's being said. So, so we will, like I had stated, we will connect, you know, once the executive team meets in May, and then kind of forecast from there what decision needs to be made to bring back to the May meeting, because as it stands, we potentially may be meeting like this again in May.
Mm-hmm.
So with that, I want to thank Karen and Chris for joining us and giving us that update. And then again, I will extend the invitation for the council members. If you have ideas and you want to see more of a wider net to be cast, so to speak, then send those ideas to Justin and he can work with Karen directly. But keeping in mind that we're still on this time frame as well. So hopefully whoever, you know, you all recommend, they're available, you know, to get feedback so that we would be able to use that from a growth perspective. So I'm going to keep going on the agenda. Justin, our director's report.
Thank you, Madam Chair. It's been an interesting month, needless to say. You know, before COVID-19 broke out, I was spending my time prepping the week of March 16th to offer an analysis of the governor's supplemental budget, 1.5 billion, of which we worked with Commissioner Harpsted and Representative Moran and Commissioner Harrington and community members to get you know, $2 million in the governor's budget for public safety alternatives to policing, so like having more community advocates work with police. And we got $4 million in the budget, in the supplemental budget, for the African American Family Preservation Act, as Commissioner Harpsted referenced. We also got an additional $18.9 million in the governor's supplemental budget around that issue. Now these things gotta be, you know, I would be remiss to just like claim that as a victory. There needs to be an understanding that some of the provisions that we were able to help get funding for do not 100% reflect the intentions of folks in the community. And so that's something that we're continuing to work on. But I will say this, had those folks not been at the table, nothing happens. And so I'm more convinced today than ever that our job, our role, of ensuring that Minnesotans of African Heritage participate and benefit from the legislative resources, policies, and procedures, social and political influences of the state of Minnesota is more important today than ever. And so, you know, I'm going to keep doing, me and the team are going to keep doing what we can to get folks to the Capitol to advance their agendas and continuing to do outreach and connect with folks in the community as well. So that's just like a quick overview. So that's why the week of March 16th, that's what I was looking at. And then we started telecommuting and COVID-19 hit. And I haven't looked at the budget, the supplemental budget, in at least a week or two. So in the COVID-19 update that I want to offer is just that we've overhauled we've added a tab to our website so that folks can get the information coming out of the governor's office, out of the health department. We've also, you know, our bulletins, if you're reading our bulletins, you'll notice it's heavy on COVID-19. We have a wonderful letter from Madam Chair herself that she wrote to the community to help encourage folks in this time of need. We spelled Councilmember Mullins' name wrong on it, so I gotta correct that and get it back up on the website, just so you know I'm paying attention. Thank you for raising that. And we're really just working hard. What was that?
I didn't add the names, by the way.
Nah, that was all us. It was
Y'all
a
do
copy
that
and paste.
every time.
It was a copy and paste, and we missed it. So my apologies.
Mhm.
The other thing I just want to say about COVID-19 is, like, obviously we're on a lot of calls on the state side and on the community side, and we're tracking a lot of issues. And so that's a good segue to introduce Amber Jones, who is the new outreach coordinator for the council. So, you know, Amber, you know, I would, you can view her bio online, but, you know, I would say this, that I know Amber from the community. So back when Patrice was here, he organized a phone bank with some of his frat and sorority brothers and sisters, and Amber came in and made some phone calls to make sure we got people out to our day on the Hill. And I just want to be clear that I've bumped into this system making a difference in community on numerous fronts and levels. And so when we got to the point where we were able to negotiate bringing her on board, I knew that we had hired one of the realists out there. And if you look at the comments on Facebook, all over the place, the text messages I've gotten from folks in community, people are really excited about her joining our team. And so I can't say enough about the energy she's brought and the work she's done, which I'm going to ask her to talk about a little bit right now. Amber, would you share some of the things that we're tracking?
Yeah, well, thank you for all of that love, Justin. Let me know if my connection is getting weird, because it's saying that it's a little unstable. But once again, hi, everybody. I'm excited to be on the team. It's 8 days in, and it's been a whirlwind getting started, especially trying to get onboarded in the midst of a pandemic. And trying to also respond to the pandemic at the same time. But we've been doing a lot of work to really just, one, try to field all of the different concerns and thoughts that are being brought up by community, and there's been a lot. Because as we know, this pandemic is not just about the direct health disparities and effects. It's going to be a ripple effect in all different sectors of our lives, from the economic to education to public safety, housing, so many things. And so we do have a running list, including the petition from ACER, just about all of the different responses in community among organizations led by people of African heritage. And there's just a kind of start there. There's been a lot of just self-determination and self-advocacy from our community. Everything from direct asks to the governor and the legislature, to just organizing resources for ourselves, making sure that our communities have the adequate supports, rapid response, making sure mental health is being accounted for, so many things. And so I do have we have a running document of that information, and as it's appropriate, we share it out, and try to use our social media channels as a place that we can share our different information that's coming out. And then also, people are starting to do like community conversations, town halls from different African heritage organizations as well, to try to, push the issues and ask the pertinent questions, the pressing questions. And I just want to continue to encourage you as council members to also encourage your networks to keep asking those questions, keep speaking up, as we already know do. But the more that we have community members stepping up and asking critical questions, that we are already trying to move through the state system, that just helps our case be even stronger, to make sure that, people of African heritage are being accounted for in these funding requests, in the way that we're reporting the data, all of the things. And so all of that is important. So on one side, we're tracking what's coming out from community. And then on the other side, we're tracking response from the state as well. And so just like you all were asking great questions of Commissioner Harpsted, we're trying to keep track of how different state agencies are responding to concerns and questions from the community. A number of state agencies have started to do different community calls or different newsletter updates or different website updates or different landing pages on their websites to try to address making sure that community is being adequately informed and that information is becoming more and more transparent for communities to access. And so, for example, I know we have Dept coming next month, and I can share this information with you, but they've started these community calls with the Deputy Commissioner. They have those Monday, Wednesday, and Thursday at 4 p.m., and they have different topics. And so, for example, that's normally like a 30-minute call. If you or anybody in your community has capacity to hop on those calls, and just making sure that community has that information so that they can represent their interests directly to the commissioner, the deputy commissioner, and Dept's leadership. So things like that, as well as just trying to keep track of the different announcements for new funding opportunities that are coming out. And I'm really grateful for the feedback that we've been getting, particularly with Aisha's petition, so that we can keep track of how, whether or not that funding is actually getting into the hands of community members, for example. So that is been a lot of work between just keeping an eye out, you know, on social media, because that's really the only way that we can like track a lot of this is seeing what comes up on our Facebook feeds, you know, on our Twitter feeds. So or just being in contact with people too, but keeping track of all of that via social media. Also, you know, there are governor's briefings daily at 2 p.m. Different agencies have been starting calls themselves multiple days in the week, as well as now more of our community organizations are starting to host virtual town halls. It is a lot of calls, it's a lot of meetings, and we are trying to, you know, share that love as best as possible amongst the team. But we are actively trying to keep this information in the loop. I just got some questions now asking about is the data disaggregated by race, things like that. So we want to, you know, be as on top of requests and on top of like questions being asked. I also noticed this week that people were a little confused about the governor's extension of the peacetime emergency declaration, which is not the stay-at-home order. So really trying to make sure we're sharing things on our Facebook that are able to address some common misconceptions as we're moving through literally a day-by-day, hour-by-hour situation. And so I welcome any feedback, any questions that you have. Like, let me know. I'm gonna take notes, trying to keep everything nice and orderly so that we can stay on top of this.
Well, you know, and Amber, I'm glad you brought that up, because what I would recommend, and especially because we're streaming this live on Facebook as well, can you, and we have community members on here, can you kind of talk about the peacetime, you know, emergency declaration?
Yes.
So that people understand that, yes, there is a difference. May 4th, and I keep saying potential because I know the question that was raised to the governor was, did he think he was going to extend it? And he said it's too early to tell. So I keep saying, well, potentially, yes, the stay-at-home order is due to be lifted on the 4th, but I think people don't quite understand that peacetime emergency is something that is actually also called out in the Minnesota Health Emergency Act. And so I think that that's one of the things that people, you know, need to understand. What does that mean for this declaration for May 13th? Can you speak to a little bit of that? Just because
yes.
And then we're going to move on through the meeting, but I think perfect opportunity since you brought it up.
Yeah, no problem. And I just want to preface this that I am not a representative of the governor's office, nor am I a representative of the Department of Health, but I do have enough to at least explain the difference between the two. So on March 13th is when the governor announced the Peacetime Emergency Declaration. That's essentially like a state of emergency, but it's not like an emergency, like, but it gives him certain powers to be able to pass executive orders more readily and to mobilize state resources more readily to address a certain, disaster of a certain kind, which in this case is the COVID-19 pandemic. So it gives him a certain amount of powers, and he allowed the state law allows those powers for 30 days. 30 days up was yesterday, which is why he had to extend it. So that's what happened yesterday. As far as the stay-at-home order, that is one of the many, nearly 30 or so executive orders that he's passed within the Peacetime Emergency Declaration. And that is the specific order that's telling us we have to literally stay at home, no unessential travel, work from home, only essential businesses are open. That initially was put into effect on March 27th. It was going to expire April 10th, but as we know, it was extended to May 4th. That is the last that we have heard of a potential end date for our stay-at-home order, which we all know that does not mean we're just going to open the floodgates to our regular lives again, but that is the specific time period in which we are being asked to literally stay at home. So really, I would say that the peacetime emergency is more of a political manifestation that is allowing the governor to have certain powers in place to move faster, to make more decisions in place. And so it's something for us to know, definitely, and it definitely has political ramifications as well as it relates to, the relationship with the legislature, as we're seeing this week. But it's not necessarily a mandate to us as the everyday people of the state of Minnesota, if that makes sense.
Yep. No, thank you for that.
No problem.
For Amber, otherwise we're going to move forward. All right, Justin.
Yeah, so the one item I do have for the board today, I first of all, thank you, Amber. Thank you for tracking those things. Thank you for breaking it down. Our community needs that information, and there's lots more coming. One of the issues that we're facing right now at the council is capacity around communications. So as you can imagine, if any of you are on any distribution list for any state agency or city agency right now, your inbox is probably full of all kinds of notices and invitations and resources and whatnot. We sent out an action alert, a statement, and our weekly bulletin. We have the statement was our one piece of like original content. We are in a situation right now where we don't know when this thing's going to end, and our community is that when the nation catches a cold, Black Americans catch. Minnesotans of African Heritage catch pneumonia, right? So how does that translate to COVID-19? So there's just a lot of information that we need to get out, and we need to be producing more original content. And so to that extent, Shakira and I, researched the targeted vendor list and found a couple different vendors. They were great vendors. I did a video call with two of them, and I called and checked in with folks before the meeting because I know this is last minute, but we sent out the contract before this meeting. I am asking you all to approve a contract so that we can consult with someone around communications. There's a young brother named Reggie Evans. He's pretty well respected in the community. He put together a really solid proposal that's in your inboxes. And yeah, we're ready to move on a contract with them it's a small contract. It's a $5,000 allotment for an annual plan agreement, but realistically it's probably only going to be around $3,000 before the end of this fiscal year. Some of the key things that he's doing is helping us to One moment. Sorry. I'm just turning off my phone. One of the key things we need him to do is, like Amber referred to, is help us put together a social media strategy. So it's one thing for us to post every now and then, which all of us do. It's another thing for us to actually have a strategy around increasing the number of followers, increasing our reach when we're promoting events and promoting content. So if we post the RFP on our Facebook page, that's one thing. But pushing that RFP so that people have that as a resource to get access to real dollars is a whole nother thing. And that is something that we want to be committed to. And so we need some additional capacity to do that. It was also in my budget proposal last year. So we're just finally getting around to executing that. So I'm happy to answer any questions, Madam Chair, but that was like the one piece that wasn't in my memo. It literally came to folks today because I was able to review the proposals last minute, and I just realized that where we're at is probably better to try to deal with this tonight so that we have the additional capacity for an extra month as opposed to, just running out at the end of the fiscal. So
I agree. Any questions for Justin in reference to the agreement, the contract?
I do. I'm just curious, of course, I'm gonna ask the same question I ask every time, given the position that I'm in now. You said you reached out to 2 other people as well?
So I only sat down with 2. So yeah, that's what, but sat down over Zoom with 2. Yeah.
Can we have the documentation of the other person? The other proposal that was given as well too?
So we discussed.
Or what made you, maybe I can just ask, what made you go with this vendor over the other? And have you worked with either before? Has the council?
We have not worked with either vendor before, except the other vendor. Well, I don't feel like it's appropriate to mention their name, because I'm asking you guys to vote on a specific contract. But the other vendor is somebody I have a great deal of respect for, someone I've bumped into in community at things that I care deeply about. And so I would recommend that we find a way to work with that vendor.
Sorry, y'all.
No need for an apology. Trust me, I totally get it. I'm missing my babies right now. But I don't feel like it's appropriate to really talk about the details. I will say that the one thing I feel comfortable sharing is that they were looking to do a subcontract, and that made sense for that vendor. And so I'm not holding it against them. Actually, I get why they wanted to use that strategy. However, just due to time, so I want to hire the person I've talked to, and I would have drug out the process and would have raised a whole bunch of other questions as far as considering the contract. And so Reggie put together a really good proposal. We know his work. We know his reputation in the community. And so I feel really comfortable rocking with him. We're talking about 5 to 10 hours a week for someone to come and help us expand our capacity on communications.
Okay.
Any other questions? Dr. Lawson, you're on mute if you're speaking. There you go. So what were you saying, Dr. Lawson?
Yeah, I was just saying that since this has something to do with viewership, publicity, etc. This person that he's recommending, how much does that person know about the Black community in general, so that he'll be covering issues from a wide range of Africans that we have, meaning people of African heritage, instead of somebody who is more narrowly focused on a particular community.
So, Madam Chair, Dr. Lawson, let me be clear, this individual is not covering issues that he's interested in. He'll be covering the work that we're doing, right? He'll be helping us proofread documents, post things to our social media that are relevant to the issues that we're working on. So this person isn't, a documentarian. He's a consultant on communications that will help increase our capacity to get out more original content, increase the number of folks who are following us, make sure that we have higher touches with our community members.
Oh, I see. So he'll be working closely with our outreach coordinator. Is that what it is?
Yeah, well, so I manage the contract. He'll work closely with everyone because let's say Amber has something going on in community that, you know, right now, if we go to an event or something, we might add a blurb in the bulletin, but we could actually do like a blog post from a community member who talked about their work with the council. Like imagine if we started telling stories about Black folks who are impacted by COVID-19, right? And use those stories to support some of the proposals coming out of our community. That's the kind of work that I'm looking to do. So but I will manage the contract. Yep.
Like that.
So was there a wide range of call for proposals for this contract, or you just narrowed it to the two people?
So it's an annual plan agreement, which is a no bid contract. So no bidding is necessary for an annual plan agreement. Anything, once we get above the 5,000, once we get to like the 10,000 mark, but then also if it's a targeted vendor, that's a whole nother process. But so it's not a bid contract. We looked at the list of targeted vendors who are in the state system. We found the Black ones, and we invited them to sit down and talk. They had a lot of questions on the front end, but I was just like, let's just sit down and talk. And then they submitted their proposals after that.
So any other questions? Because I want to be cognizant of time too, because we're at the top of the hour, and I know we still have to vote and just have one other quick thing after this.
I have one last quick question, only because there was photography in there, and I know we had, oops, did I cut myself off? Can y'all see me?
No, we can see you.
Oh, I don't know where y'all went, but okay. Because I know we have a photography contract out there, but
just through the end. So just to clarify, his contract also includes photography and video. That's just something that he does. Primarily that's kind of a bonus. We do have a photography contract with Tamika that goes through the end of the year.
That was just my question of what he was going to be doing differently from what she's already doing in contract.
Yeah, I mean, I don't have Tamika working on any photography projects right now. Really, it's about, what we need him to do is help us generate some original content and really like take full advantage of the conversation we need to be having with our community right now.
Okay. Just feels weird because I can't see y'all, but okay, no more questions.
Yeah, no, I will say we see you. So I need, if there's no more questions, I just need a vote. I need somebody to, to call for a motion to vote to accept Uncommon Media and Consulting for this contract.
So moved by Crawford.
Is there a second?
So second, I second the motion.
So second, Doe?
Yes.
All in favor?
Aye.
Aye.
Any opposed?
I'm assuming that you have called for discussion, Madam Chair.
Before I call it yes. Any abstention? Discussion.
I vote, oh no. When we're voting, we don't discuss. Okay, I vote yes.
You said discussion, Madam Chair?
Is there any discussion?
Oh, so we're going back to vote. Okay.
For as far as discussion is concerned, I think one of the things I want to just reiterate in terms of our presence, our ability to get out there, social media, by every medium, as much as we can enhance that. I think that's a good step for the council, because we need to have what we do out there for people to know and see it. And it's very important, of course, how we do it. And if we can enhance it this way, I think it's a good move. Make sure that happens.
Yeah, I know this is kind of last minute thing, but it should have been good for us to know more about his work, see examples, and then tell us about other organizations that he has helped. Those kinds of pieces of information would have been good to have.
I agree. Yeah.
Yeah, and we had I had that conversation with Justin. So I'm gonna pull back just because I know we're all on mute, and I'm gonna have Shakira do a roll call so that we can go back over the voting. So I know it's already been properly moved by Crawford and seconded by Vice Chair Doe. So Shakira, can you do roll call so that I know who's all in favor? So all in favor?
Okay. So I'm just going to do a roll call and let me know if you vote yay or nay.
Yeah.
That way I can track this a little bit better.
Or abstaining.
Yes, or abstain. Let me know as well. All right, Vice Chair Doe.
Yeah.
Treasurer Lawson. I didn't hear you, Lawson.
Oh, I said yes. Yeah. Oh, yeah.
Secretary Jamali.
Yes.
Councilmember Nandi.
Yes.
Chair Hughes.
Yes.
Councilmember Mullins.
Yes.
And Councilmember Crawford.
Yes.
Thank you.
Okay. So it sounds like it's all everything for yes. So the motion is carried. Last item, are there, because I know we're a little bit over, are there any announcements that anybody has that we need to talk about or discuss? All right, hearing none, if I can have a motion to adjourn.
Don't move.
Is there a second? All right.
Second Mullins.
The meeting's officially adjourned. Thank you all. You guys have a good one.
Yeah, you too.
Shakira and Amber, will you please stay on the call after folks log off and we can just do a quick debrief, like 2 seconds.
One quick note, Madam Chair, as far as filling out our request form, is that going to be done for us attending the web meeting?
Yep, you still would, yep, you would still fill that out.
Okay.
So Shakira will send that, she typically sends it out shortly after we hang up. Then she'll send out the form and just, you can do your electronic signature, fill it out, and then get it back to her, and then it'll still get processed.
Outstanding. Thank you all. Stay home, stay safe.
But we're not paying for mileage, just FYI.
All right.
Right.
You want to stop recording, or I can.
At least stop doing the Facebook thing.